Lung cancer is the leading cause of cancer deaths in the U.S., and the Lung Cancer Foundation of America is trying to change the perception of the disease. So today we have a doctor and lung cancer patient joining us. And doctor, should we be getting tested for lung cancer at our annual exams?
Well, lung cancer is most commonly a disease in patients who have smoked, although we know clearly that lung cancers can also occur in non-smokers. What we currently know, based on the scientific evidence, is that individuals between the ages of 55 and 77 who are current or former smokers should be screened, particularly if they have been, if they're former smokers having quit within 15 years. Those are the individuals at highest risk, and that's the current recommendation.
And what is the latest on using a nasal swab to diagnose lung cancer?
Well, nasal swabs are one of a number of different diagnostic techniques that we're looking at to try to improve early diagnosis of lung cancer. The nasal swab is actually a small brush that's inserted into the nose to remove cells from the lining of the nose. Those cells are similar to the cells within the lungs that may actually cause lung cancer. So by examining those cells, we may be able to establish the diagnosis of lung cancer without a biopsy.
Wow, that is fascinating. And David, you've been diagnosed with lung cancer twice as well as prostate cancer. So can you share your story with us?
I'm happy to. I was diagnosed with lung cancer approximately 18 years ago. It was a chance diagnosis, which is generally the case with most lung cancer diagnoses. I had thought that I was a pretty healthy specimen. I had recently climbed Mount Kilimanjaro. I had also completed the San Diego Rock and Roll Marathon. I went for a standard routine heart scan. The results with respect to the heart were fine, but in a footnote it indicated that there was a spot on my, a spot on the lobe of my lung. I followed that up with my doctor. It turned out to be malignant, and I had surgery and the lobe was removed. I continued to be followed by my physicians for the next 16, 17 years. 2 years ago, I was diagnosed with lung cancer again when another spot was found. The key, I think, to my survival fits in with what Dr. Aberlie has been talking to you about early diagnosis and how an early diagnosis benefits and gives us one of the better and best chances, if you will, for survival from lung cancer.
Co-founder of the Lung Cancer Foundation of America. So how has lung cancer research helped you?
Well, the research has helped me and many, many others in many ways. First is early diagnostics. I think that I am a good example of that. The evolving treatment methods that are being done now in terms of immunotherapy as well as targeted therapies are going a long way to helping lung cancer patients. Luck has played a role in my survival, but as I often say, luck should not be the key. Rather, research should be the key to hope and survival for lung cancer patients.
Yeah, definitely. And what can our viewers do to help?
Your viewers can go to lungcancerfacts.info. They will find information about not only Lung Cancer Foundation of America. There are some wonderful videos that will explain these therapies that Dr. Aberlie has talked about. It will give you information about clinical trials. It will give you lists of names together with addresses of people and institutions to contact with any numbers of questions you might have about lung cancer. And this is something that we find is an invaluable tool for not only lung cancer patients, but their family as well as their friends.
Thank you both for your time, and we'll be right back.